This is HubWonk. I'm Joe Salvaggi. Welcome to HubWonk, a podcast of Pioneer Institute, the think tank in Boston. As the grim milestone of 1 million US COVID-19 deaths approaches, new data reveals that nearly as many people have died from the effects of the pandemic as have from the disease itself. This remarkable observation that the unseen deaths were equal to the numbers seen was not made by public health leaders at the CDC, but rather by actuarials of the life insurance industry, those experts tasked with measuring mortality rates to price policy risks. Their analysis found a nearly 40% spike in year-over-year deaths from 2019 to 2020, but determined only half of those excess deaths were from COVID. These data suggest that the societal public health reaction to the virus, including mitigation and messaging strategies, caused as many deaths as COVID-19. Now, as vaccines and acquired immunity have substantially reduced those seen COVID deaths, is it time to change our focus toward the unseen excess pandemic deaths to begin to stem a tide that may last far longer and claim more lives than the COVID-19 virus itself? My guest today is Pioneer Institute's Senior Healthcare Fellow, Dr. Bill Smith. Bill has researched and written extensively on the unintended and largely unnoticed consequences of pandemic mitigation measures. He has discovered substantial evidence that changes in individual behavior, such as foregoing medical screening, checkups, and chronic illness treatment, have inevitably led to an increase in excess deaths. Bill will share his views on the failure of public health leadership to use their high-profile platform to anticipate and address elevated risks from other human diseases, and offer his thoughts on immediate steps healthcare leaders must take to stem the rise in non-COVID pandemic-related deaths. When I return, I'll be joined by Pioneer Institute's Dr. Bill Smith. Okay, we're back. I'm Joe Salvaggi. This is HubWonk, and I'm now joined by Pioneer Institute's Senior Fellow, Bill Smith. Welcome back to HubWonk, Bill.
Thank you, Joe. Glad to be here.
Well, Bill, it's good to have you because we're going to cover a topic that we've covered quite a bit in the past. Of course, it's going to have to do with COVID, but something that you and I have alluded to several times is that our focus on COVID talks about health vis-a-vis COVID. And there's a lot of other ways that people lose their lives or die. And just this past week in the Wall Street Journal, I saw two articles that really spoke to your and my conversation about these excess deaths that are unrelated to COVID. In fact, it was a piece entitled "Rise in Non-COVID-19 Deaths Hits Life Insurers." They're the people who pay out, they pay a lot of people to actuarials, a lot of money to actuarials to decide how many people are likely to die in any given year. It's fairly consistent. And suddenly we see a spike. One of the statistics cited was a spike of 40% excess deaths in the US during COVID relative to years without COVID. So let's start our conversation there. We've got 40% increase. Some of that has to do with COVID and some of it has to do with non-COVID. So let's start with you. You've recently had a presentation on this issue. So I'm going to let you carry the ball and talk about COVID deaths relative to all the other ways people die in a given year.
Yeah, Joe. So during 2021, I started constantly reading healthcare and life sciences blogs. And I kept noticing articles indicating that the number of people that were getting screened for traditional diseases, cardiovascular disease, cancer, diabetes, go down the list, even mental health. The number of screenings that were happening were just dropping through the floor. People were not going to the doctor. Primary care visits were down 20%. And so people weren't getting blood pressure screenings, weren't getting A1C screenings for blood sugar, weren't getting cholesterol screenings. And so I wrote this paper last fall where let me just read one line. I'm not going to bore your listeners, but I basically said the difficult question that should be asked is, did public officials create such a climate of fear around COVID that they neglected to encourage people to visit their physicians and receive regular screenings for chronic conditions? And I think the question I raised is now coming home to roost. The life insurers in this Wall Street Journal article are starting to report their earnings, and they're not only paying out life insurance payments because of COVID deaths, they're paying a lot out because of non-COVID deaths. And the actuaries attributed this to the fact that people aren't getting screenings or didn't get screenings in 2020. And so their conditions got worse and their conditions were not monitored. There are many conditions that have caught early, even cancer. If it's caught early, it can be solved, and there might not necessarily be mortality. And I think what we're seeing is that a lot of things were not being caught early.
So let's put this in perspective. I want to put a fine point on, because you do a nice job of quantifying, let's say, how people died in 2020. COVID, we hear a lot about the 375,000 people who died in 2020 of COVID. That's a terrible number. Every one of those lives is a tragedy. But in the same year, 691,000 deaths from cardiovascular disease, 600,000 deaths from cancer, 160,000 stroke, and 100,000 diabetes deaths. If those conditions are not properly diagnosed and treated, if all those numbers go up, suddenly it starts to eclipse even the large COVID deaths. Essentially, that's what we're talking about right now.
Yes, that's what we're talking about. And, it's a little bit of Monday morning quarterbacking. Public health officials had a very difficult challenge with COVID. It was a virus they hadn't seen before. They didn't know how dangerous and lethal it was. So I don't want to criticize them too much, but you should do Monday morning quarterbacking because you want to see how you perform poorly in the last game. And I think public health officials perform somewhat poorly in not reminding people to go get screened for traditional chronic conditions. Anthony Fauci was on TV probably 1,000 times during 2020. And I don't recall him ever saying, he talked a lot about vaccines, and I'm big on vaccines, but I don't recall him ever saying, you know what, people shouldn't ignore the traditional diseases that can kill them. Go to the doctor and get screened. Wear a mask, social distance while you're in the doctor's office, but go to the doctor. And I didn't hear a lot of public health officials saying that. And again, it's Monday morning quarterbacking, but they should have been saying that, because I think that the drop in screenings is having a devastating effect.
Well, you even put a number on the drop in screenings. You cite in 2020 alone, primary care visits down 21% in the second quarter, blood pressure screening down 50%, cholesterol screening down 37%, telehealth surged 35%. And this podcast has been a big advocate of telehealth. But of course, telehealth can only do so much. At this point, it can't lay hands on a patient, and it can't reach through the screen and screen you for so many of the other things that can kill you. You also measure the drug decline. In other words, those drugs that people take to mitigate these diseases, such as I'll let you go through. We're talking about hypertension. We're talking about all sorts of cholesterol medicine. So let's go through those one at a time. Let's talk about hypertensive. What kind of declines did we see with people addressing their high blood pressure?
Yeah, again, hypertensives are cheap generic medicines largely. So they're not expensive for patients to go get, and they can be effective. There are some very good generic anti-hypertensive medicines, and sales worldwide of hypertensive medicines dropped almost 10% in 2020, and that shouldn't be happening. I mean, I think with lockdowns, I think obesity and health problems that would cause hypertension probably accelerated. And yet you had declines in the sale of medicine. We saw a similar decline in atorvastatin. I think the JAMA did a study of the top 10 drugs in the United States and how their sales declined during COVID. And atorvastatin, which the brand name is Lipitor, but it's now a generic, is one of the most commonly prescribed drugs in the United States. And again, prescriptions for atorvastatin were down about 10%, which translates into 10 million prescriptions or more. So there were 10 million prescriptions for cholesterol lowering drugs that didn't happen. And so you got to think that this is going to have some implications for cardiovascular disease. And I think the article in the journal the other day indicated that it has, that cardiovascular disease accelerated in 2020 because people weren't diagnosed, weren't getting medicines, and weren't being treated.
So in other words, we thought, okay, in 2020, we're focused on COVID as we should be, but we're neglecting all these other reasons that people need to care for. So again, I cited some statistics that your I guess fair to say, twice as likely to die of a heart attack in a given year than in the worst year of COVID. Well, one needs to take precautions if vaccines are around, but one should pay at least as much attention to the other ways. We're talking about things for heart attacks, things for cholesterol, as you mentioned. I think the data is clear that we all got a little bit fatter during this lockdown, so
Yeah.
our hearts had a little more stress. Perhaps you were out there exercising a little less. I know running, I'm a distance runner, running with a mask made me less likely to put on the shoes.
Yeah.
So we exercised less, ate more, and all the while didn't take our blood pressure medicine, our cholesterol medicine, and all of these kinds of things. What else can you say? What are some of the other? You mostly seem focused on heart and heart related. How does one, in a sense, hedge their bets against the dreaded killer of cancer? What more could we be doing or could have been doing during the lockdown to address cancer?
Yeah, Joe, honestly, when I started the paper, I initially had the ambition of looking at all the major screenings and declines in all the major screenings. And the data was so overwhelming because cancer, diabetes, you name it, every therapeutic area where there are diagnostic screenings had declined. And I just thought the subject matter was too voluminous to put in one paper. So I limited it to cardiovascular disease, largely because CV disease is the #1 killer. So I wanted to look at how diagnostic tests, but I've seen anecdotal articles and studies about declines in mammograms, in A1C tests for diabetes, for mental health screenings, in every therapeutic area, there were great declines. And you know what the traditional screenings are when you go get a physical for cancer. You get a prostate screening if you're a man, you get a mammogram if you're a woman, and those my strong sense, and I didn't chronicle this in a study, but my strong sense is those screenings declined dramatically.
Yes, indeed. And again, you and I talked about an article. We haven't had much time to digest this article. It came across our wire, the U.S. News and World Report talked about what seems in hindsight a somewhat obvious threat to health is the spike in maternal death rates in 2020. And it's dramatic. An increase of maternal deaths of 44% in 1 year over the year compared earlier. Let me see if I have that right. Yes, 44%. And again, I'll add some color to this. That spike was not amongst non-Hispanic white women. They saw almost no spike. This was almost entirely amongst mothers, expecting mothers of Hispanic or Black. So this is a spike in the least, or I would say the most vulnerable populations. They perhaps were the ones most likely to avoid routine care or checkups that are so needed when one is expecting a child. Can you say anything about that and how it dovetails well with your overall thesis?
Yeah, it's another story that similar to so many stories that just seem to be coming out about 2020, that the normal course of healthcare events. So if you're an expectant mother, my wife was constantly going to the doctor for prenatal visits and getting prenatal vitamins and doing all of those things that expectant mothers do. And it looks like there was a serious decline in the number of prenatal visits, which led to particularly health disparities for Hispanic and Black mothers, expectant mothers. This is just, at this point, it's just another area of the healthcare system where we saw such major declines in the preventative medicine that should have been happening, that again, I have to hold public health officials to task on this, because they weren't reminding people to go to the doctor. They were constantly talking about vaccines and social distancing and masks. You couldn't get away from that on the news when a public health official would appear. But I don't ever recall them saying, you know what, go back to the doctor for your regular visits, because there's a lot of things that should be happening to prevent worse outcomes in traditional disease areas. And I just don't remember public health officials talking about that. And I think we're starting to see the evidence roll in that, particularly in 2020, the decline in the number of diagnostic screenings that was happened has increased mortality in a variety of areas.
Yes, I think particularly at this moment in time, again, we can do the Monday morning quarterback, is that's how you describe it, or some sort of reckoning and saying, look, we should have done X instead of Y. But I suppose that's water under the bridge. Right now, one has to assume now that we're somewhat much more highly vaccinated, and we've gone through this Omicron wave with, we've decoupled cases from deaths. We have a relatively low death rate when compared with infection cases. So I won't say we've licked COVID, but it's come down to very, very small numbers of deaths. One has to assume the spike in deaths from a lack of care that happened in 2021, if people aren't ready to roll up their sleeves and get back to their doctor and get their screening, I would imagine this spike in non-COVID or COVID-related death or non-COVID related death is going to continue well after COVID is long gone. In other words, if you miss cancer today, you get it tomorrow, that excess mortality is going to appear in next year or the following year's numbers. Is that fair?
I think that's right. I think that's right. We're going to continue to see these spikes. And, again, not to carry the football analogies, but I don't want to spike the football in this and say, I was right. We should have been talking about this, as I said in my paper last year. But public health officials should now say, okay, COVID's declining. People need to get back to the doctor and get screened. And there should be an entire campaign on the part of public health officials to remind people about the traditional diagnostic tests that they should be getting. When I was writing the paper, there's an agency, a federal agency called the U.S. Preventative Healthcare Task Force. I think that's the name. I forget the acronym, but it's basically a bunch of voluntary physicians who come together and they suggest diagnostic tests that should be routine. So they look at sexually transmitted diseases, cancer, every therapeutic area you could imagine. And they look at the tests and they make a recommendation. People above this age, for example, should get this test or that test. And, I went on their website when I was writing the paper and I'd seen all these studies with the declines in diagnostic screenings for all of these prominent killing diseases. Yet the task force was making no recommendations. They were just going along with their business. They made a recommendation about chlamydia during 2021 and chlamydia screenings. I think they should have mobilized and said, hey, we're the group that's recommending screenings. They should have had a campaign and been ringing the alarm bell that these screenings that we've been recommending for decades are not happening. And there just was not any urgency in the public health community about this. And unfortunately, we're seeing the mortality results of that.
Yes, indeed. I would say, it's often been a criticism levied at the public health community that this terrible pandemic has made TV stars out of many of them. But what you're saying is, despite their now newfound power and attention and voice, that they're not using that voice in the way that we would expect public health officials to use it. In other words, we have to prioritize based on risks and benefits. With COVID now somewhat diminished in its risk and additional information somewhat diminished in its benefit, the next marginal benefit of advising for vaccines seems to be somewhat diminished. We really have a sort of silent killer that is killing at least as many people or more than COVID did at its peak, and we're more or less ignoring it.
I would agree with all that, and I'd also add that the lockdowns were a killer for traditional diseases. They simply were. They kept liquor stores open, they kept grocery stores open. They should have been saying, don't just go to the grocery store, go to the doctor and get your traditional screenings. And nobody was saying that I recall. I think there should be some Monday morning quarterbacking going on to say, hey, wait a minute. If another pandemic comes along, don't lock down the whole public health community. Don't lock down all physicians. There should be attention paid to traditional diseases.
Do you see now, again, this is something you study all the time. Let's hope this Omicron means the end of Omicron may be the end of the pandemic, and we're going to have to deal with perhaps new variants that rear their ugly head, but we are going to live with this thing now. do you see any signs, green shoots of healthcare people bringing this story to the forefront? Of course, we just cited the Wall Street Journal articles. Do public health officials have to, in a sense, take the blame, or can they just simply move on and realign and recalibrate their focus going forward?
I'm not seeing evidence that they're recalibrating their focus and talking about this. I'm hoping the Wall Street Journal stories and the editorial that the Wall Street Journal wrote will instigate some change on the part of public health officials. And again, I don't want to engage in recriminations. The COVID pandemic was a difficult challenge. It's something we hadn't seen before. But public health officials should now just say, okay, that was water under the bridge. We probably made a mistake in locking down physician offices and preventing people from getting screenings. But starting today, they should be saying, okay, let's go back and let's start doing the kind of things we should have been doing in 20 and 21. I'm hoping that somebody will say that an Anthony Fauci or a CDC director or somebody will say, okay, Omicron is way down. The pandemic seems to be waning. Everybody needs to go back and get screened for diseases that are killing people at a greater rate than COVID.
Indeed. Again, I'll take this, we'll wrap up our conversation by bringing it back to where we began. You and I, on earlier episodes of this podcast, said we were concerned that this might be the case. It might be the case that fear of COVID could be killing more people than actual COVID. Now we have the actuarials at the life insurance company saying, indeed, you're right. Only half of the excess deaths were directly caused by COVID. The other half were by the neglect of all the other diseases that kill us every year. We now have that data. It's irrefutable. And that should be the marching orders now for the public health community, saying as COVID recedes, we have a new crisis that we need to roll up our sleeves and shine a spotlight directly on.
That's absolutely right. And the title of the paper that I wrote, again, this was last year, asked the question in the title, is there an impending tsunami in mortality from traditional diseases? And I think the data is coming in that there is a tsunami that's happening. And people are just dying in their 50s and 60s because they hadn't been screened in 2 years.
Mm-hmm. Indeed. I think it's a very powerful message, very important message. I don't understand why it isn't the headline, but who knows? Perhaps this podcast can help move the ball a little bit. Where can our listeners learn more about your research? Is it published on the Pioneer site?
It is published on the Pioneer Institute site. And again, it's the title of the paper is An Impending Tsunami in Mortality from Traditional Diseases. I think if you Googled an impending tsunami in Pioneer Institute, the paper would come up.
Indeed, and this tsunami is going to persist long after COVID. I think tsunami is a great analogy because it leaves in its aftermath a lot of suffering for many years after the wave hit. So,
absolutely. They think of a slow-growing cancer like colon cancer. If you're not screened, the results can show up 5 or 6 years later, and the screenings are just not. They weren't happening.
Yeah, indeed. So, all right, that's our call to action. This, in fact, all our listeners should be calling their own doctors and getting those screenings, taking the medicine they maybe weren't doing during the past 2 years, and getting back on track, getting healthy, maybe all go on a diet, all those good things, and move forward. So thank you for being on the show today, Bill. You're always a wonderful guest.
Thank you, Joe. Thanks for having me.
This has been another episode of HubWonk, a podcast of Pioneer Institute. If you enjoyed today's episode, there are several ways to support us. It would be easier for you and better for us if you subscribe to HubWonk on your iTunes podcatcher. If you'd like to make it easier for others to find HubWonk, it would be great if you offer a 5-star rating or a favorable review. We're always grateful if you share HubWonk with friends. If you have ideas, suggestions, or comments for me about future episode topics, you're welcome to email me at hubwonk@pioneerinstitute.org. Please join me next week for a new episode of HubWonk.